I've been a veterinarian for 17 years. I graduated from Cornell back in 1995. And since then, I have been doing relief work around central New York. I've worked at 30 different veterinary practices in the area. And I noticed over those years that there were a lot of animals that just didn't seem to respond as well as I would hope to the medicines that I was giving. There was always the wondering if there's something that I could do better. I decided to look into alternative medicines, Chinese medicine specifically. I learned how to do acupuncture and herbal medicine and diet therapy, and I think it's been a huge benefit. Pfeiffer is an 11-year-old German Shepherd. Fast. Hi, honey. Hi, honey. Hello. Who has intervertebral disc disease. He has flare-ups and episodes, so I've also been treating him for about 6 months now. He's been to Cornell several times, and he has flare-ups of extreme pain, and again, he's on many medications, and he also has weakness in the back legs, and he's starting to get fecally incontinent, so he's having more accidents. And that's actually what the owner brought him to me for, because in traditional Western medicine, there's not much you can do for fecal incontinence. So we're working on that as far as slowing that down, supporting his back, and making his hind end as strong as we can, and obviously the pain. For him, pain is a major part of what's going on. So I do electroacupuncture on him. The electroacupuncture is hooked up at different points on the meridian, so 2 different points at opposite ends of the meridian often. And so it sends a very mild current between and up and down the meridian, which is very relaxing and soothing. Again, most animals really like it. But again, it gives you a longer result if you can use some electroacupuncture.
The original reason I came was because my German Shepherd was having trouble with his back and his rear end, and I had been to Cornell and they said they really couldn't do anything for him. He also was having trouble with fecal incontinence. He has 2 herniated discs, and there really wasn't anything that Cornell could do for him. And I had talked to my vet about acupuncture, and he recommended Dr. Kayser. It's been very, very helpful for Pfeiffer, and I think it's also for Tarzan. They both seem to be responding very well to treatment. We've done some Chinese herbs as well as acupuncture. They both seem to have responded very nicely, and it's much, much better. I think it's a lot less pain.
Tarzan is an 18-year-old Tonkinese. I've been treating him now for 5 or 6 months. He has a liver mass and some kidney disease. So his appetite's still good. He's still pretty active, but at 18, I'm assuming he also has some arthritis. So we're treating him for arthritis. I can't stop the mass from growing, but I'm trying to minimize the effects of the mass. And we're supporting his kidney function. And so far, he's responding very, very well and is very active for his 18 years old. Zoe is a 15-year-old dog who came in primarily for weakness in the back end and arthritis. So we are trying to treat her to alleviate any discomfort she may have. She's on several Western medications right now, and we're hoping over time we might be able to decrease or even stop some of those medications. As you know, a lot of these medications that we get are chemical-based and can have side effects. And so doing something that's more natural, which will give you the same effect, is of benefit. So we hope with time we'll be able to wean her down or off of the medications that she's on. And we also are hoping to stimulate her mentally and have her feel good, keep her appetite going as long as we can, and allow her to get around and to explore her environment, which also mentally will keep her feeling good and sound. Joker is a 3-year-old dog that was referred to me for a lameness problem that we couldn't identify the source of. His regular veterinarian had seen him several times. He went to Cornell. They did x-rays and could not find an explanation for the lameness issues. He's a very active dog, plays frisbee, plays balls, goes riding with his owner out on the trail, and obviously this was a problem for his lifestyle if he had this lameness. So the owner decided to try some acupuncture to see if that would improve things for him. And we had a very favorable response. After about 3 treatments, the lameness has gone away. And he enjoys the acupuncture also. And he's just a delight to have.